Welcome to today's webinar. Over to your moderator, Kaylin Pettit. Please go ahead.
Hello, everyone. Thank you for joining today's transformation webinar, and welcome. We always really appreciate you giving up a portion of your lunchtime for these updates. You'll notice that we have shortened the meeting time to half an hour today, so we're going to try really hard to stay on pace so that we can all enjoy our lunch at 12:30, if not earlier. Today we have, as usual, we'll have some updates from some of our senior leaders across transformation projects. Rob McIsaac will start, and he'll give some brief updates on a few of our transformation enablers. Next we have Dr. Michael Stacey providing an update on CQI. We'll also hear from Sharon Pearson on Strategic Performance Collaboration, or SPC, as well as some updates regarding our Hamilton Health teamwork. Michelle Beals will talk about where we are with MES, Managed Equipment Service, and some upcoming milestones on that project. And then we'll have Dwayne Bender, who will talk about the latest and greatest with our digital health plan, including our hospital information system project. This webinar is being recorded, and as usual, we'll have it available for you on the hub after the event. And I do encourage you to, at this time, if you haven't already, dial into the phone number from your mobile device versus your desk phone to listen to the webinar. Phone lines will be muted until the Q&A portion at the end of the webinar. At that time, you can ask questions over the phone, or you can type them into your Skype chat box at the bottom left-hand side of your screen. Lastly, if you're having any technical issues with the webinar, please call the help desk, extension 43,000. And now I will hand it over to Rob to kick us off.
Thanks very much, Kaylin, and good afternoon, everybody. Maybe I'll just start by, as always, thanking everybody for all the hard work that is going on within the organization. I know how much pressure everyone is under, given both, serving the needs of our patients while at the same time trying to manage to a budget. Very challenging for sure. I think looking ahead, we're facing another challenging year. We'll have to wait and see what the province comes out with, but I don't think they're going to make our life completely easy in the coming year, no matter what. So I think despite all of those pressures, though, that it's important for us to stay the course with respect to the transformation activities that we have underway. As I always say, I think we're not doing these transformational activities despite our challenges. We're doing these things because of the challenges that we're facing. Let's just go to the next graphic. I really like this graphic. I think it encapsulates in one page so much of what's important to us as an organization. At the core, those four icons represent our strategic goals around our patients, our people, sustainability, research, innovation, and learning. That larger circle around the outside talks about the big directions we're pursuing as an organization in order to try to get us to our goals. So operational excellence, which is really about creating a profound alignment across all of our activities, an enterprise approach, meaning that we need to think and act like a system as opposed to a collection of hospitals. Strategic partnerships, being open to new approaches by working with others outside of HHS. And population health, turning our attention away a little bit from the supply of service and trying to influence the demand for our services. I think it's important to see all of these things as, not being added work, but rather these activities will help to enable us to achieve our vision. They're all deeply intertwined. With that, I'm going to ask Michael Stacey to provide us with an update on the first of our 5 enablers, continuous quality improvement. Michael.
Yeah, thanks, Rob. So with regards to CQI, we're continuing to make good progress in onboarding units and departments to CQI. And we now have, as of today, 85% of inpatient and emergency care areas actually on board with the process. Another key factor is that we've also had significant patient and family involvement, and now within about 12% of the 5,000 improvement opportunities since 2016, patients and families have been actively involved. The key initiatives that we're currently working on are to obtain external support for the next phase of CQI, and in the coming year we'll focus on effectively integrating the executive level of the organisation into the CQI system. There are a number of additional initiatives that we'll be undertaking to mature HHS towards operational excellence. And these include ensuring that the unit level concerns are more effectively escalated when appropriate, and that the unit learnings are spread across the enterprise, so really integrating that in a way that creates sustainability. More effectively deploying North Star metric objectives across the organisation and bringing our strategy to life is also one of the other key initiatives we're looking at. And finally, ensuring the management system actually helps us to enable the implementation of the other transformations that are underway at HHS. So a fair bit of work to be ongoing in the next 12 to 18 months. So I'll now turn over to Sharon Pearson, who's going to talk about the Strategic Performance Collaboration and the Hamilton Health Team.
Great, thank you, Michael. Good afternoon, everybody. I'll talk about the SPC first, and we are making excellent progress. We continue to work through the negotiations with our preferred partner, and we are not finalized, but we're very close to getting to that point in our conversations, which is great news. Many of you participated in the co-creation sessions that we held at the end of January and into early February in one of the three streams, those streams being the labor productivity, the non-labor, and the patient capacity optimization. I do thank everyone for your responsiveness. We booked those meetings very quickly, and many of you adjusted your schedules to participate. It was an excellent opportunity for the vendor to have discussions with you and for the vendor to understand some of the challenges and pressures in our organization. So thanks for that. A few of you did reach out that didn't participate, asking how you can become involved in the SBC work. And certainly once we finalize the contract, we'll have much broader and wider engagement and be able to have more of you participating, a lot more of you in the processes. The other clarification I wanted to make, because I get this question often, is how the SBC differs from some of our other vendor engagements. And our previous vendor engagements typically look at analysis and staff engagement and recommendations. The SBC is much, much different in that this is about a collective wisdom and a collective work with our vendors. So we will be looking at scoping the work, implementing the work, making decisions about the work together over a much longer period of time. So it is a very different and unique partnership for us at HHS, and I'm very hopeful that soon we'll come back and be able to launch and move forward with the work in the upcoming weeks. For the OHT work, the OHT, I think as everyone knows, is a big ship, so it moves slowly, but it is moving. We have our three clinical work streams, so those secretariats, I'll just remind folks, are the older adults with the multiple chronic conditions and the child and youth and adults with mental health and addictions, and then we have supporting streams in governance, digital, and home care. So all of those groups are working, and we have highlighted, or I've highlighted previously, the areas of focus in each of those streams. The major areas, though, are looking at geographical cohorting, so focusing on particular areas of our city that we might infuse concentrated resources, and we're just determining what that location is right now for the older adults. Expansion of the RAM clinics, which are the rapid access addiction medicine clinics, and more mobile geographic clustering for the child and youth with mental health and addictions, along with transitions for that population as well. There was a two-day session with the ministry this week. The message there remains constant in that there will be no provincial resources to support the OHT work as we move forward, and that is a significant challenge for the teams. The one caveat to that is there may be an exception for some of the digital work. So we're awaiting an update on what that might be. So hopefully good news to come. There are updates posted on the Hub as well as our HHT website that we strive to keep current for everyone, or you can reach out to me with questions. And with that, I'll pass it over to Michelle for an MES update.
Thank you. So I just want to give an update in regards to where we're at with our managed equipment service partnership arrangement, which is with Siemens. So that contract will take effect April 1st, 2020, and the Siemens will be responsible to work with us to procure the renewal of equipment and maintenance of over 500 pieces of equipment in the areas of diagnostic imaging, nuclear medicine, and the MDU across all of our sites. Within the next 3 years after that contract starts, we expect to have 50% of the equipment in those areas replaced. And by the end of 5 years, 100% of that equipment will be replaced. And this is a significant investment which will allow us to break the cycle of underfunding equipment in these areas, which is truly important to continuing to ensure that quality care. As we've shared last month, some of the benefits include we will consistently have an upgraded fleet within diagnostic equipment. Physicians and staff will have better access to technology and training. The patients will benefit from better or more accurate diagnostics with less wait time. And we'll also have the benefit of improved patient flow. We'll look to hopefully reduce repair costs as we are no longer managing equipment beyond useful life. And that will also translate to less downtime and a more stable procurement process as we will plan for this equipment and commitment multi-years in advance. In terms of what's really happening since we last brought this topic and what will happen in the next month, really a lot of the focus is around the transition and the ability to transition the service component or preventative maintenance for this equipment to be effective from our current vendor to Siemens. Staff will have a new number to call. It'll be a 1-800 number, and they will have the ability to reach 24/7 service center, which will be staffed by someone at Siemens. The call center will be located at the Dravinsky Hospital, and Siemens will have an operations manager on site, as well as they will have offices and staff presence at all of our major sites, and will be there to support this work on the ground. Work is underway to transition to Siemens on April 1st, and there will be communication and a rollout plan that will be coming out in the month of March as we get ready, and so people will be appropriately ready and prepared to support that transition. We are also working with our colleagues in Biomed to support this transition. As we continue to plan out, the work will also focus on procurement and project-related work, and as that translates or transpires over the next couple months to a couple years, as that equipment comes out, more and more people will become involved in those project-like things. At this point, I'd like to turn it over to Dwayne Bender, who'll give an update on the digital health plan.
All right, good afternoon, everybody. Just a few things I wanted to say about the digital health plan. Just before Christmas time there, we finished our desktop equipment renewal, which was about 4,500 computers that got rolled out in about 6 weeks. So it translates into about 100 computers per day that went out. And we just wanted to say thanks for all the help that we got along the way. We know it was very disruptive, but it's a really important enabling project for us for our new hospital information system. Those computers went out with the specifications that they will be ready to run the new HIS when it arrives. So thank you for that. The next thing I wanted to talk about was really the single sign-on and the tap to sign-on project that we're running. So the goal here is for clinicians to be able to use their badges to tap and sign into systems, eliminating them from typing their passwords multiple times per shift. So we're hoping to really speed things up. We're doing some piloting right now. As you know, we have a complex environment here. So we're running a pilot in our regional rehab clinic down in Wellington, and also some spots in the JCC now.
are trying out the technology, and we have seen a few glitches, so we're slowing down to make some adjustments with the vendor and go forward. But we're really hoping that this is going to be, we know that from other sites, other systems have reported that this, once it's fully rolled out, is a very effective solution, and it really helps to speed up clinical time. And of course, I should say a few words about the Hospital Information System project. We're, of course, one of our big projects that's on the way. We are currently engaged with a consulting group doing a readiness assessment, and that's really looking at the organizational capacity, the resourcing plans, our communications approach, our governance and decision-making approach as we head into a new hospital information system. And they're also helping to us evaluate our procurement paths, so either going alone with an HIS procurement through a competitive process, or the possibility of joining another partner that's also going in for a large HIS installation. So there's a few like St. Joe's here, and there's others in the province that are currently going through this. And the group that we're working with has done this for other health systems and is aware of what's going on in the province. So it's been very helpful to get that kind of inside information from them. I think that's it for me, Kaylin.
Great. Thanks, Dwayne, and to all of today's speakers. I think that may be record time for us in terms of webinars. At this point, I'll turn it over to our participants for any questions. So as a reminder, you can either ask a question using the Skype chat function or through the phone line.
Thank you. Please press *1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience. Once again, please press *1 on your telephone keypad if you have a question or comment. There are no questions registered at this time. I would like to turn back the meeting over to Ms. Pettit.
Thank you. So just one last call for questions via Skype. Okay, we'll take that as a very good sign. Thanks, everyone, for tuning in. Oh, sorry, we have one question just under the wire. So Laura's asking when we can expect CQI to be rolled out to the entire organization. Dr. Stacey?
Yeah, so I can speak to that. There is still a progressive extension of the units throughout the organisation. I don't think I have a date for when we'll be completed that rollout, but I think it's certainly continuing in waves as it has done previously, with the next one beginning fairly soon. I think in terms of that vertical integration, horizontal integration, and that striving towards operational excellence, we're working with some vendors right now, and hopefully we'll have selected a vendor within the next month or so. That work is projected to be, or their work plans are 6 to 12 months, but it will be an ongoing piece of work beyond that to develop that within the organisation. But certainly we should start to see some change from that within the next 12 months.
Excellent, thank you. And finally, any final questions before we sign off? Okay, so I think that's it. Thank you again for tuning in, everyone. Please keep an eye out for our latest transformation e-newsletter this week, which will include a recording of today's webinar as well as a post-webinar survey. We did have a few responses to last month's survey, but I'll just reinforce that it's really important to us in communications to hear your feedback so that we can continuously improve how we deliver these updates to you. So that will, again, make its way to you via the Transformation e-newsletter this week and Leaders Weekly on Monday morning if you're part of that distribution list. And then stay tuned for next month's webinar in your calendars.